Hi Shell Point, I'm Christy Skinner, Vice President of Healthcare Services here at Shell Point, and I'm joined today by John Thorpe, Director of Connections, and Rachel Zellers, Director of Long-Term Care. And we're here today to announce to you we're holding our second annual Healthcare Forum. We're going to have two sessions to bring to you. One is going to be on February 10th at 1:30 in the Grand Cypress Room, and the other one is going to be on Thursday, February 13th at 2 p.m. at the Village Church. So last year's Healthcare Forum was just an informative session to talk to you about where the year before was in healthcare, some of the accomplishments that we have, and then also looking forward to see what is healthcare going to bring to you for the next year up and coming. So Rachel, because you were brand new to us last year, tell me a little bit about what you thought was beneficial from the Healthcare Forum, what it brought to our residents, and your experience with it.
I thought it was a wonderful event. I was pleased to be able to share with the residents my vision, especially since I was new. And I had a lot of feedback from people asking questions about where I plan to go and what we plan to do to improve the services at Pavilion. So overall, I think it just offered a wonderful window for the residents to hear what the plans were.
I think that's a great summary. I know that we oftentimes get the question of how can you communicate more to our residents and how can you share the information about what all you're doing, because we're doing a lot in healthcare on all fronts, because we know that that's the desire from our residents.
Right.
Do more, research more, bring more programs to us. So without sharing too much, so we get residents to come to the Healthcare Forum, give them a little bit of insight as to what are some of the things that you're proud of from this past year, and what are you looking forward to sharing at the Healthcare Forum?
I'll be talking about some of the accomplishments that we had last year. It was a wonderful year for us in many perspectives, from a regulatory standpoint and from a recognition standpoint. So that's a great indication of the quality of care. And then I'll also be talking about a little bit of boring stuff like the Medicare reimbursement and some things like that that changed. And then going into this upcoming year, there's so much happening that I want to give the residents a glimpse at some of the vision for the second floor, as well as some of the upcoming changes that will be happening with Waterside, because it's not that far away now and we need to start preparing our systems.
Excellent. I tell people all the time, I feel like half of your staff already has the boxes packed and ready to go
Yes.
to move to Waterside, because we are so excited to go to the Larsen Health Center and move into the Waterside neighborhood. I am envisioning that you're already preparing for some of the new programs that we have been discussing and sharing with the Shell Point community.
Yes.
Tell me a little bit about how you are preparing for some of those new programs for Larsen Health Center.
The biggest preparation that we're doing right now is on the second floor, where we're starting to look towards having smaller neighborhoods of 20 residents, and how that programming will look, how the staffing will look. We're excited to be bringing UCLA's program to some of our residents on the second floor. So all of that is not only to meet our current needs, but in preparation for Larsen Health Center. The other thing is looking at dining. So we're having some exciting changes coming with dining that will be, again, in preparation for the move, but also enhance the experience now.
Wonderful, thank you. So I'm going to come over to John. John, you didn't join us for last year's program because you weren't here yet.
Correct.
It seems like in some ways you've been here for such a long time. You and I have known each other for a very long time, so that's probably a part of it.
Right.
But as the Director of Connections, one of the things that I think is a shift for the organization is that we have focused so far in our memory support a lot on assisted living. And in long-term care, Rachel gave us a peek behind the curtain to say that we're reinventing our approach to long-term care services for memory care. So I know that's one of your initiatives, but share with the Shell Point community what you're looking forward to sharing with us at the Healthcare Forum.
Great. Well, I'm so glad Rachel brought up the second floor, because that work is underway now. Even though Larsen Pavilion's a little ways away, we're working today to improve the second floor operations right now, and it's just a great, fun team to work with. From an assisted living perspective, we are looking at our respite programs and re-engineering those as well. So we have our program at the Arbor. We have our program that's going to be up and running at the Springs, and we have a smaller program at King's Crown. So we are going to look at all three of those and really try to enhance that and make it just enjoyable and beneficial to all of our residents in assisted living and independent living who would want to take advantage of that. So again, stay tuned. There's a lot of work being done that we will be presenting at the forum itself. One program that I'm just super excited about is a program that the residents actually started, and I've talked about it a couple times. It's the Carefree Connections group. It was a resident idea. The Healthy Living coordinators have done a phenomenal job in moving that forward, and we're going to make that bigger and better. And when I say bigger, instead of it being a once-a-month program, it's a once-a-week programming.
Oh,
so
wow.
There's a lot of work in getting the programs in place. The dining team, they do a phenomenal job. I was with Josh last week, and he just does an amazing job, and we're going to continue to develop that program. From a connected living perspective, in our at the assisted living community, connected living at the Springs, we're doing a lot of activity, and you'll get a sneak peek on that at the forum. But the highlight is dining and activities. We're really stepping up our efforts there. But the thing that everybody is just most aware of is our UCLA Connections Cafe. Dr. Small talked about our program in relation to the many programs that he's seen throughout the country, and he said out loud, "We're the best." Coming from a guy that has seen so much and is an expert in the field, for him to give Shell Point that recognition, I think everybody that helped put this together, and it's been, as you said, I've only been here for a little bit more than 3 months, but I know you and Martin have been working on this for a really long time, and it's got to be so rewarding to see it really coming to fruition, and I'm excited to be part of it. As you said in your opening comments, there's a lot going on in healthcare. I just talked about 4 things, and there's so many other things that we're doing, and so stay tuned at the forum. We'll be talking about what Rachel and I talked about, plus more.
Yep. All right. So Shell Point, as you heard from John and Rachel, we have both of them joining us, myself, members from the Healthy Living Coordination team, from the Assisted Living team, from our medical director, Dr. Gary Goforth, and others to share with you the vision for healthcare as it is now and the vision for the future, because it is bright and exciting. So please join us on those 2 dates. That's February 10th at 1:30 at the Grand Cypress Room, February 13th at 2 o'clock at the Village Church. We look forward to seeing you all there, and thank you again for your support of all things healthcare. And until next time, stay healthy.